I think we have failed miserably in focusing too much on what's going on in the academia, what's going on in the high income levels, which is a fantastic model, but we have to think of the people who do not have all those resources. We have done great strides and wonderful improvements in high income countries. And they have a strong drive, they have strong associations, they have the resources, and they have done beautiful jobs. They're publishing, they're doing research, they're driving the agenda in amazing ways. But we have failed to bring those resources and enabling the individuals working in the low and middle income countries to the same degree. The gap has widened, and the ones in the high income countries are the ones that are getting the best access to care. The individuals in the low and middle income countries actually still are in similar conditions that were 20 years ago. There's some improvement, but not to the degree that we would like to see. I'm the Executive Director of IAHPC. I have been in this role for 17 years, a little over 17 years. And I'm very proud of the organization. We started very tiny and now we have grown. I have a great team of people that work with me. And IAHPC is not just myself, but the board, the members, the staff. Everybody has a very significant role here, and they've all played their parts. IAHPC is based in Houston in the US, but our focus is it's a global mission. We have a global mission, so we don't work just in the US, we work everything around the world is our concern, and we have a focus on countries that have very limited resources. So we support, first of all, development of hospice and palliative care in the world, and we either work with governments supporting policies if they need that kind of technical guidance. We also support the academia when universities are developing programs for educational issues related to palliative care, either in the curriculum or seminars and courses, and they need support and guidance on that one. We also support policies for access to medicines, and we work with the governments when there's limitations on the prescription, on the use, the dispensation of opioids, and we do these workshops to help develop strategies. And finally, we also provide guidance on how they can implement services and what they can do to increase those number of services and reach out to the most people. We did a survey of all the members of IAHPC and asked them, why did you become a member? And 85% of the responses was that they support IAHPC's mission, vision, and the work that we do. And when we look at the IAHPC mission and the vision, we work to, it's focused on relieving suffering. And that's the underlying theme. And of course, the mission talks about access to medications, education, policy, implementation of services, but it's all to relieve suffering and increase the quality of life. So it's the underlying thing that bonds us together, and everybody feels the commonality with this issue of relieving suffering. Now, as individual members, there's a lot of benefits that we offer. Those are access to journals, to most of the palliative care journals we've included. They can also apply for traveling scholarships to attend a conference like this one. And they can also get scholarships to other seminars and meetings. All they have to be are educational. And then we also have another program that is called Program Support that institutions can apply for. And that's for core development and seed development of programs that they want to develop. Hospice and palliative care means providing care for individuals who have palliative care needs, and it doesn't have to do anything with the diagnosis or the prognosis, and it's about relieving the suffering and improving the quality of life of patients. And this is either physical, psychosocial, or spiritual needs, and it's about addressing the whole person needs plus the family. So it's a very holistic approach to the care. We look at issues related to physical symptoms that happen in palliative care that are very distressing and cause a lot of suffering: pain, nausea, constipation, diarrhea. Then we have the physical, in addition to the physical, we have the social suffering. And these are people who have probably facing issues related to the network. They're isolated from their families, and then they don't have any kind of support. There's psychosocial suffering. In addition to that, could be with issues related to the existential, concerns about, is there anything after life? Why are we here? Why me now? Those issues that may generate anxiety, depression. Also, the spiritual suffering, the needs of, is there transcendence in the being, and I need that kind of support. Palliative care provides support to all these aspects of of all humans. And what is the biggest amount of suffering? Well, we can measure in some ways access to palliative care with some not very reliable indicators, but one of them is the consumption of opioids. When we look at the data that it's reported by the countries on how much opioids they're using, we can conclude how much access, we can infer how much access they have to pain treatment. And what we have seen throughout the years is that the global consumption is increasing, but the consumption is happening in the high-income countries. The low and middle-income countries, where the vast majority of the population lives, don't have access or have very limited access. It's estimated about 5.5 billion people live in these places. And so when you relate that to how much suffering that is really happening, it's amazing. It's really, I don't know how you can go back to being just your normal life when you know that this is happening. One of the things that we need certainly is, in addition to, of course, the members who are sort of like the critical mass that is able to move this forward in the countries, we also need the support from the funders that are the ones who enable us with the funds to do the programs that we do. Unless we have the funding, we won't be able to keep doing the work we do. We only can do so much with so little, and I think we're very good at it. We distribute the funds in ways that we are very, flexible, and we can either expand or limit the size of our programs depending on the budgets that we have. It's very important. Getting together is the capacity to do this kind of network. Now, IAHPC doesn't own a conference, and so we decided not to have a conference because the regional associations, the IAHPC has already one Congress, which is this one. Asia Pacific Hospice Network has a conference for Asian countries. APCA has one for African countries, and the ALCP has one for the Latin American countries. And we didn't want to compete with that. So what we've decided is we go along with these big regional congresses and support the regional associations in these congresses by bringing in people who otherwise couldn't come because they don't have the funds. So we have these scholarships, and the ability for them to come here, present their posters, participate in the presentations, and attend these wonderful conferences is a great way to promote and develop and empower them to continue doing the work they do in their countries. We have seen great results, and one of them, for example, I'm one of those examples. The first time that when I was in Colombia and I was able to travel to the UK, I went to St. Christopher's Hospice. This was in 1988. And for the first time I was able to see what I had read about. I could feel, I could sense, I was there. I went to St. Christopher's Hospice and I had read about it. And I felt very passionate about this, but I had never seen it. And I was able to see the benefits of providing palliative care. For me, it was a life-changing experience. So I know how important that is because I had that opportunity. And we also have responses from the individuals that we've supported throughout the years. It's more than 500 now. When we get the reports and the responses to the questions that we send them about, was this good, a good meeting for you? The responses are amazing. And they are able to connect and then relate their own situation to what is happening in other countries. Some of those countries may be similar to the countries they live in, and then they can share resources, they can have guidance, they can learn from their own experiences and apply them in their own countries. It's amazing. The grantees are doing amazing jobs in their countries, and if they don't have the ability to publish, if they don't have the ability to travel and show what they're doing, it doesn't get the exposure that it needs to get, so that it's being seen by the other individuals who have more resources. So those connections when those connections happen, enables the people to publish, to say what they're doing, to tell to the rest of the world in ways that maybe they don't have that kind of access. But the ones in the high-income countries don't have a lot of the limitations that individuals in the low-income countries have. And there's a lot of learning there because they have to cope with challenges, shortages of medications, shortages of personnel that high-income countries don't face. And for them, it's a beautiful learning experience to see how their colleagues in low-income countries are actually adapting and being able, with all the limitations and the restrictions that they have, to do the work they do. A lot of the people agreed that the systems are structured in ways that doesn't allow the individuals who need palliative care to be included in the healthcare system very easily. We have to find ways on how to do palliative care because the system is set up in ways that it's just for curative approaches. I think that bringing this together and putting all the palliative care movement into the picture and doing the international issues relates to knowing that this is a global situation. The healthcare system is structured in ways that doesn't allow the palliative care movement. That also brings and broadens the concept of palliative care and the perception of what palliative care can do. And also our duty and our responsibility as an international organization to bring awareness to that, of what is going on. A lot of the funding that happens for palliative care is usually conditioned to national programs because some funders are interested in supporting palliative care programs that benefit their own communities, which is fantastic. I agree with that. But at the international level, we have a very important role to play. We work with the United Nations, we work with the World Health Organization, we work with the Commission on Narcotic Drugs to bring awareness on the international policy issues. These issues that are related to access to medicines, issues that are related to cancer control policy, global policy, the issues that are related to the Sustainable Development Goals from the United Nations. So unless we are able to align the community strategies with what is going on at the international level, then we won't be able to benefit the locals in the way that they could. Unless we have that capacity to bring awareness of what goes on the international scope, which is happening, and we as international organizations have that mandate to bring to the national associations and at the provider level the knowledge of the policies, international policies that are being discussed right now. So unless that whole structure gets in a flow, the community won't benefit. A lot of these countries have representatives in the United Nations. They have individuals who work in their missions, and then they go to the United Nations and they're told how to vote. They're told by their own governments, the state departments, on how they need to vote or how they need to reflect or how they need to position themselves when some of these policies are being discussed or their resolutions are being voted on. And some of these papers, which have a great potential to influence development of hospice and palliative care in the countries, don't get brought down to the national level. They are voted on, they're approved, they're accepted, but they remain to be fantastic documents in Geneva, in Vienna, or in New York. So our role is to help these fantastic documents and resources and tools, bring them to the national associations and empower them to use them so they can work with their own governments and say, your own government, our own government voted to approve this document in Geneva, voted to approve this resolution in Vienna. Why aren't we complying? and then they can work with their own government to make that happen. Of course, we work on the international level. Now we're talking about policy. International policy we work, but also in terms of capacity building, we work with individuals at the grassroots level. This is empowering individuals by transferring of knowledge, by empowering them to attend meetings and teaching experiences that they can share their own experiences and also learn from experiences from other countries. And they are able to bring back all the new knowledge and this new opportunities for collaboration back to their own country, so they can build using those core components to help develop palliative care in their own countries. And that's a very powerful way to start and promote and develop the hospice and palliative care that they need. This is where we see the real action happening. This is where it becomes, where we can see the benefit happening at the bedside level. Unless we do that, we will be disengaged from our mission. Our mission is to improve, quality of life of patients and their families. And the only way that we can do that is if we can translate those documents at the bedside to improve the quality of life, that it's, for that patient and the family. And by empowering the provider, by transferring the knowledge, by education and access to medicines, they can provide better quality of care to the patient and to the family. And unless we are able to connect that, those will be just documents that are out there, and it won't benefit anyone. We won't be achieving our mission. So they benefit in two ways. One, we are able to continue providing the access to the journals and the scholarships and the opportunities to educate, and learn a lot of new things, and also by empowering them to become speakers in their own countries to their own governments. We give them sort of that kind of push so that they go to their own governments and say, I represent the National Association and I'm also affiliated with an international association, and I can talk about palliative care, and it brings them to a level that the government then sees them in a different light. If they're able to go and present posters and maybe do an oral presentation, when they come back, they're seen in a different light. I think what the perception of their colleagues is different, and it changes. It puts, it's a different stature now. They have been to an international conference and their poster was accepted. And it's a wonderful way of empowering the grantees, because they have to be the voice of their patients. They are the ones who can talk to the ministers of health and say, this is what is happening. And when they build that credibility, when their stature changes, they are more empowered to attend to meetings in the ministries of health and talk to the ministries, talk to the governments and say, the patients are suffering. The patients in palliative care usually have a very low voice, or they don't have a voice. And providers have to be the voices of the patients. They have to be the advocates, advocating for palliative care and improving the quality of life of the patients they care for. When we don't have enough funds, we have to cut down our programs. That's the first thing that happens. And when that happens, there's a negative impact at the grassroots level, because they are the ones who benefit from our programs. And when we don't have enough funding, the scholarships that we are able to provide are less in numbers. And maybe, sometimes we have to say we can't attend this conference. There's another impact that it has. It's also, we need to think about, can we continue giving benefits, the benefits that we have been providing? Are we able to continue paying for access to the journals, which is something that they value greatly? The other thing is, can we continue supporting governments when they ask for technical guidance? Governments don't pay us, so they ask for technical support, and that's a wonderful opportunity, but we have to have the funds to be able to collaborate with these governments. I think the first thing that we have to think about is not giving the people, cookie cutter models. They have to own the plans, they have to own the strategies that they develop, and they have to own whatever they do to improve palliative care in their own countries. So what we can do is enable them to develop these plans and these projects. For example, the workshops on opioid availability and rational use, they have to develop their own plans. They own those plans. And what we can do is support them to help implement those plans. But we are just enablers. And when we have more funding, we're able to do more workshops like the opioid workshops we've done throughout in 10 countries. We can extend those to 20, 30 countries around the world, all these countries that don't have access to medicines. So if you are either an individual or an institution, you can join. If you are a member of one of these foundations that wants to do something on global health and palliative care, we will certainly welcome your support to IAHPC. There's many ways. So if you're an existing IAHPC member, you can donate to IAHPC in addition to paying your membership. You can also bring members to IAHPC. If you are a member in a high-income country, you can continue, joining IAHPC, supporting the organization. You can join as a lifetime member, and you can also provide, if you have the time, you can join the groups that go to do teaching, palliative care teaching in any low-income or middle-income country. You can also provide, coaching and mentoring opportunities for people working in these countries and when they're developing their own programs. If you're a member in a high-income country, you can also sponsor members. You can also pay for the membership of somebody in a low-income country, and that enables that new member to apply for a scholarship. So there's wonderful ways that you can become, like an agent of change for many individuals in the low-income countries. If you are in the U.S. and you are an individual working in a company, sometimes these companies most of the companies actually have a program that is called matching funds. And the way that you can do support, and you can support IAHPC, is you can designate and you can tell the company that you can assign, a percentage of your salary every month by, maybe you say $30 or $100 or whatever you want out of my paycheck. Instead of giving it to me, give it to this organization. And what the company does is matches that donation from your salary. We actually have individuals who are working employees from Apple, from Hewlett-Packard Computers, from AT&T, from Bank of America who do that. And it's a wonderful way to support it. If you're just somebody who wants to support IAHPC and you do not live in the US, there is a donation page that you can go on our website, and you can use a credit card, you can send a check, or you can do a PayPal payment. And either way, we accept it. It's a wonderful opportunity for individuals to help an organization that is helping others around the world. If you're an individual who lost, a loved one, and you want to help because you are grateful of the care that they receive, we can also take donations on memory and behalf of the person. And it's a way of connecting, that nice, beautiful care that they were able to receive to an organization that is helping to develop this hospice and palliative care movement in other parts of the world that don't have access. It's my mission in life. This is my mission. I do what I do because this is my mission in life. I wake up every morning and I think I have to do something for the people who are suffering. This is what drives me. When I think of the 5.5 billion people that live in the countries that do not have access to medications, and you think about the pain, that's what really gets me going every day. Even though, I may be tired, I may be jet lagged, this is why we have to stand up. We have some extraordinary examples. Of course, one of them is Uganda in Africa that has, in spite of all the difficulties that they face, even with the healthcare system that is complex and with a lot of challenges, they have been able to implement palliative care services and do palliative care changes in the access to medicines that have enabled a lot of the patients and the providers to have better quality of care. The other countries that I can think of course, are, for example, Costa Rica in in Latin America. It's a small, tiny country that has wonderful projects and programs that has universal health coverage and includes palliative care in the system. Other countries that I can mention that are doing great improvements, like Ecuador, Argentina, and countries in Asia. In India, Kerala, of course, the state of Kerala has been like a shining star in India, but other states in India are also now making important improvements. Countries in Eastern Europe like Romania, Poland are also great examples of how you can do very good palliative care. So yes, there's examples in every region that all the countries around them can look up to, and then they can use them as guides, as role models. The individuals who go back to their countries can make a very big difference in their local settings, and they become agents of change. If we have one of those individuals in every setting, that becomes a global movement. And if we're able to do that throughout the globe, it's going to be a wonderful revolution, palliative care revolution.